At NYSCSH, our number one priority is keeping schools informed and healthy. You can count on us for accurate information and resources. You can count on us for training that helps you care for and educate students. You can count on us for support and assistance. It's what we've always done. It's what we'll always do. Stay safe and informed with NYSCSH. You can count on us.
Good afternoon. My name is Linda Khalil and I'm Director for the New York State Center for School Health. If you are joining us for our virtual webinar series and Zoom discussion on the required New York State School Health Examination Form, you are in the right place. We did this last Thursday, and immediately after we finished the Zoom discussion, we got some updates that we know will be helpful for folks. So we're coming in to repeat the process again. This webinar is being recorded and we will have it up early next week so that you can come back and review it with the resources that Melissa will share. Melissa Trow is with us. She is our nursing resource expert here at the center, and I'm sure a lot of you have talked to her on the phone. That is her expertise, and she's going to be sharing what we know as of today. And again, things change rapidly. So the one thing that you'll hear often during our chat today is please go to the website and look at the resources that we're updating continuously. And if you're not in our email system, please take the 60 seconds it takes to sign up, because that's our main communication tool. I will now turn the program over to Melissa Trout.
Hi, everyone. As Linda said, I'm Melissa. I'm sure I've spoken to many of you, if not all of you, at least once since I've been here. I want to thank everyone for taking time out of your busy day. I know things have been very hectic lately, and we do appreciate you taking the time to join us here today. This is an opportunity for us to connect with you, for us to be able to answer some questions in our chat, and I'll go through how to go about doing that, as well as talk about something other than COVID for a change. So let's get started. So if you're not familiar with Zoom, this slide will help you get acquainted. You can share your questions by clicking at the very bottom of your screen. You will see an option for a chat, and you can type in your question. It will go to Linda and myself, as well as our moderator and all of the attendees that are here today. So you can ask us a question. You can chat amongst yourselves, and we will be monitoring this throughout the program. We will try and answer all, if not all, the questions. We will answer as many as possible during the time that we have with you today. We will, as Linda said, record this session. We will document any questions that we receive today. We'll compare it to our FAQ page, which you're going to learn about today. We're going to compare the two and make sure we can bring them both together to make sure it's a full frequently asked question page so that we can answer as many questions as possible. So we are here today to talk about the required New York State School Health Examination Form. Why a required form, you ask? Well, it's a standardized form to ensure that all the required components of a health exam are listed on a health exam form and that it's complete. I'm not sure about all of you, but I, as a school nurse, would receive all different types of forms from local pediatricians' offices in the local area. And it was like a hen and peck trying to find BMI, weight status category. You're looking for medications and not able to find them. It could be on the front of the page. It could be on the back of the page, the bottom, the top. So this form is really created to provide a consistent, uniform, standard form so that nurses are not hen and pecking looking for their information that they need on their students. This form will also help providers go through, as we do exponentially, through each portion of the form so that they're touching on all of those assessment elements that are required in a health exam for a student. With that, we are hoping that there will not be missing information, although we cannot guarantee that. This is a learning curve, and we are here to support our local pediatricians' offices in learning this form, how to use it appropriately, and the elements that are on it and why they're required. Why? Go ahead, Linda.
I just wanted to interject for just 1 second that part of what Melissa has been working on is the FAQ page. You heard her mention that. We'd like to just get a feel for how many people have actually had a chance to look at that FAQ page, because it answers every single question that we've gotten up to about 20 minutes ago. So we do have a poll, and that might help Melissa and I provide better feedback and information for you. We can get a drill down of where everybody is at. So go ahead and take the poll.
Great. So it looks like about 38% were aware of our FAQ page, 59% were not, and 3% said, "What is that?" Great. Well, we know that you're going to learn something new today then. So back to the health exam form itself. Why now, you ask? Why is this required form being implemented now? And I don't know about you, but I am very grateful to be working and dabbling in something other than COVID for a change. It's a little COVID reprieve. So why now? This required form was instilled in regulation 2 years ago. Some of you may have already been aware. Some of you may have heard about it, anywhere between 2 years ago and today. And some of you are probably hearing about it for the first time today. So 2 years ago, this was instituted in regulation for this required form. It has been up on our website since May of 2020. Some of you may have been aware of that. Some of you may not. I can tell you that I've received calls from local pediatric providers' offices saying, "Hey, we heard a buzz around town that there's a new health exam form. Where can we find that?" And we would take them right to the website where they could access that. So I know some of the providers are aware of it. Nurses have been aware of it because I've received calls from a lot of you school nurses saying, where are we at with this required form? Is it required now? Are we waiting? And the message to all school nurses was, well, right now it's not required. We are utilizing it because it's on the website. So we encourage you to print it off, send it home to your parents, send it to your providers, get it out there circulating so that people can become familiar with it and they know that it's there and in its existence, kind of like a transition time. So what are we doing now? Really, now is the support of the consistent use of this form now. We're going to do this through educating our parents and providers with resources that we have created for you here at the center and put on our website. And we're going to get to that in a little bit once I share my screen. What was the delay for the 2 years? Well, the delay was really, we were finessing and fine tuning some of the elements in that form that we received feedback from local providers about what they wanted to see in that form and how they wanted to see that form created. So we tried to implement those as much as possible, as well as try and create them an instruction sheet to support them in implementing this required form into their electronic record system. Most providers now are electronic, so they wanted an opportunity to do that. So we needed that time to create that instruction sheet that they could share with their electronic record vendor systems. We are on the New York State Center for School Health website. I'm sure you're pretty familiar with it. This is our A to Z resource page, and it is under the letter H for health examination. I just want to point out any new information that we provide is usually in red, or you will see a star with the word new in it right next to that content piece to indicate what's new on that page. There's so much information on these pages, it's really hard to keep track. So Linda and I came up with this idea to try and help support a branding or sticking out of what is new content. So anytime you visit one of our pages, you're looking for either that new star or you're looking for red font. On the health examination form, on the health examination page, you will find the required health exam form for schools. This is a regular old documented form that you can print off, send to the pediatrician's office, and they can go old school, pen and paper, fill it out. The second element on here is the PDF fillable form. So this fillable form is really nice because it can be downloaded to your school district's website where a parent or a pediatrician can access it. You can download it to your computer or desktop and send it via email if you have email connections with your local pediatrician's office, so that they would have a PDF fillable form accessible to them as well. The red title here, instructions for completion of the New York State School Health Examination Form, EHR compatible form. This is actually an instruction sheet, and I'd like to open it up for you for a moment. If you can just bear with me. This is an instruction sheet that we are encouraging you to preview yourself, because you will learn what are the elements in a on the required health examination form, as well as sharing it with your parents or providers, I should say, so that they're aware of what needs to be included in that required form in order for an electronic compatible or equivalent form to be considered or accepted. So I just want to point out the titles here. There's health history. These are the chronological order that these elements need to be placed in order for an electronic equivalent form to be accepted by a school. So it would be the health history, and then you will see the numbered elements underneath. So the first item would be health history, and it would include the chronic medical conditions. It would include, things such as asthma or seizure disorder or diabetes, and the list goes on, as you can see. The next element would be laboratory and diagnostic testing. So it goes in that chronological order. Now, that's not to say that that electronic equivalent form is going to be identical to the PDF or the Word document or form that we have on our website. It is not. It may have boxes just like those forms. It may not. It just may be a narrative, but it will have all of these elements in the order in which they're listed on this instruction sheet. I also want to point out to you, to ensure that you have the correct form, because if you don't clear your cache on your website, which I learned how to do, you will see old information. You want to be sure that it says the EHR compatible form, and you also want to make sure that it is page numbered at the bottom, 1 of 2, to ensure that you have the correct, most current instruction sheet. Again, as I said, we put things in red to let you know that it's new. We also try and date, if we can remember, after each item that we upload to the system so that we know when it was last updated.
Melissa?
Yes.
Can I interject for a second? Because that was a confusion last week. And when you just showed the form, the highlighted subject headers, so health exam, health history, labs, those are really the chronological order. If things within those segments are not quite 1, 2, 3, 4, 5, that is not what we're asking for. And if you could bring that back up one more time, I think that it helps that understanding that it's the broad category that needs to be in the chronological order, not, if it's allergies, then seizures and diabetes. That's not what the detail of what has to be in the same order. It's those broad categories as you look at the form.
Okay, thanks for clarifying. The next item on this page you will see are the resources that we created at the center to help school nurses and medical directors in the school community to educate parents and providers about the required health exam form. I'm going to just open up this instruction. It starts off with an instruction sheet for school nurses and medical directors on what elements or items are available. They are linked for easy accessibility. It talks about the required form effective date, the actual form, and the instruction sheet. It talks about the resources we created, which we're going to get to as we scroll down, the sample parent guardian notification, the sample healthcare provider notification, and the FAQs, which we're also going to get to. I'm very excited about. This is a scrolling document. I just want to point out that although this is 3 pages or 4 pages, we created it this way so it's one click. It's easy to access it. We encourage you to remove, delete whatever pieces of this running document you do not need at that time. The second one is the actual parent guardian notification. And then the third page is the sample healthcare provider notification. And
Melissa, before we leave that, I know you're going to talk about what we're recommending on sharing all the forms with all the people. And I don't know if you want to just show that form one more time so everyone can see that the parent has a portion, the provider has a portion, and really what we're trying to do is be that bridge. Just like we're the bridge every single day between the school and the parent and the medical home, we're trying to facilitate making this easier for everyone by educating everyone about everything.
Mm-hmm. Absolutely. So again, we spoke about some provider's office may have heard about this form. Some of them may not have. Parents may have heard, parents may not have. So where are we today? We're here today to try and educate, get the word out. This is the buzz around town. We're going to communicate with our parents. So this packet can be printed off along with the actual document, the required health exam form, the instruction sheet for the electronic health record equivalent form that the provider would need, as well as these sample forms can be adapted for your school district's needs. You can send it as a complete packet. I used to be very, very close, had rapport with nurse managers in local pediatric offices, and I would just reach out to them and say, hey, this is what's coming down the pipeline. Please share this with your providers in your offices. Some school nurses have that. Some school nurses don't have that. And so then they're going through the parent to share the information with the provider. We're encouraging that you share all pieces of the information, the parent letter, the provider letter, the required form, and the instruction sheet as a complete package along with the FAQs to the parent to share with them so that they can understand the required form and why it was created and what it's for. They can then share that with the provider at the time of the appointment. This also allows an opportunity for the provider who is just hearing about it for the first time to then have a hard paper copy of this health exam form, because they can always go old school paper and pen and fill it out. They may not want to do that because they're used to, we're so electronic savvy now, and so they're used to their electronic record system, and that's great, that's a nicety, but the required form is a necessity, and so having it as an electronic record document may be later on down the road, so they'll have to implement that at that time. So again, we're encouraging the use of the entire packet to be sent to the parents. This can be shared with the parents through email, US postal mail. We encourage it being posted on districts' websites for parents who have internet and have access to that. We also encourage schools to share it with their PTA, PTO to get the word out. This is a change. This is new for most people, but not for others, and change can be hard, and so it's going to take a village. We're here to support, encourage, educate, keep things moving along in the way that they need to, and ultimately it's for the student's best benefit. So we want to make sure that the student has a full, complete physical on the correct form. We have a complete FAQ page here. You can tell I'm very excited to get to this because I've been rushing along to get to this point. This FAQ page is full of information about anything you want to know regarding the required form. And after today, if it's not complete because we have new questions in the chat that we haven't answered, it will be complete by early next week, because we will be adding those questions with the correct answers so that you have that information. This page is the page we're encouraging you to print off and include in your packet. And I'm going to show you really quickly how to do that. If you have your mouse on the page, you right click, it will give you an option to print. You can then print this off as a document and embed it in your packet and share that with your parents and providers. And we encourage you to do that for accessibility.
This page is updated, and as of today, after this presentation, it will also be timed, because what we realized last week was the discussion of this really allowed people to go back and read and understand. So this page will have both a date and a time at the bottom of it so that you know what is the most current, and you can see that here this was the last time it was modified. So that will help you make sure it's current. If there's one thing we've learned in the last year with COVID, having the correct information that's the most up to date, that is the most accurate, is the base for everything that we're working on. And we'll be doing that in conjunction with the New York State Education Department, who has been working with us to try and support schools, understanding again that this is a challenge for some schools and parents. It's new information, which leads us to brand new information that we actually just finished about 22 minutes ago. Correct, Melissa?
Correct. So this is the new information. New York State School Health Examination, the required form is required, as we discussed, per Commissioner's regulations. However, considering the challenges families and schools are facing due to COVID-19 pandemic, schools are encouraged this school year to educate parents and guardians and healthcare providers regarding the new form and assist them in transitioning to the correct form. If the form you received is not on the required New York State Health Exam form dated 2020, as you will see it on the bottom of the form, or an electronic health equivalent record, as we discussed earlier, send a copy of the incorrect form back to the healthcare provider and the parent or guardian with a copy of the correct form. Again, we're trying to educate our families and providers, as well as the instructions for the completion of the New York State required form. Requesting that the provider complete it on the new form. During the remainder of this school year, 2020-21, schools in collaboration with their medical director may choose whether health examinations documented on an incorrect form after attempting to obtain the correct form will be redone by the medical director. For the 21-22 school year, all student health examinations documented on an unacceptable form will need to be redone by the medical director. Now, I want to preface it and remind those school nurses, because most school nurses are not working during the summer months, that the school year begins July 1 every year. So this should take a little burden off that September craziness. So just please remember that July 1 is the beginning of the school year.
And one last thing is we have become aware that the form that is currently up in NYSCSH in the health commerce system has not been updated yet to the current form on our website, the New York State Required School Health Examination 2020. So if a provider downloads that form and uses it, please accept that and then use this time to educate providers that we'll be moving to the form come July 1st. Melissa, anything else? We can monitor the chat and we'll have a chance to address that.
I have nothing else to add. That was good that you remembered that.
As you can see, Melissa and I, even though this is all we've been doing for about the last week is reading every one of these, we understand that this is another thing that's happening right now. And the New York State Education Department actually created this additional guidance that we shared tonight, which will be a new FAQ by tomorrow so that you can read it, you can share it, you can print it. And really that's saying, let's help everybody by educating, informing, and supporting. That's really the key to this, because the new health exam actually contains every required component that is required in law, not just that it's good to have for kids and to help make sure that we have healthy students and have that information. Some of those components that other health forms that received in the school didn't always contain the components required by law. So this puts everybody back on the same page. And if any of you lived through the attestation, when that became a requirement back in 2017, you've been here before, and it was your ability to be that educator that really helped that be successful. We know we can count on all of you to do what you do every day, and that's do your best for kids and their families. We're going to sign off for tonight, and we will take the chat questions, and by tomorrow, please look at the FAQ page. It will be updated with the new information as soon as we can confirm the answers to the questions you have shared.
Mhm.
Thank you again.
Thank you.
Hope you have a great evening.